This is a read of Written in Bone, Buried Lives in Jamestown by Sally Walker, Chapter 5, Part 2. Suspicious Causes. Close study of the boy's skeleton at the Smithsonian Institute showed that his health and general well-being had been neglected for some time. His right humerus had a healed fracture near the elbow. A rib and two leg bones had formations of abnormal bone, and some of the boy's vertebrae exhibited an unusual amount of bone destruction. Owsley had seen these conditions in the bones of people who were known to have suffered from tuberculosis, a disease that infected the lungs and sometimes the skeleton. Tuberculosis often enters the spine. The Levy neck boy's bones may reflect the early signs of tuberculosis. The boy's teeth were in atrocious condition as well. Of the 30 teeth that were present, 19 had cavities, 3 large enough to have completely destroyed the crown. 5 teeth in the upper jaw and 2 in the lower had been badly infected to have left signs in the jawbone. These pus-filled infections must have been ongoing for many weeks, probably months. The teeth, even more than his other ailments, must have caused the young man a great deal of pain. In fact, the infection that resulted from the terrible abscess around the boy's teeth probably spread throughout the boy's body and poisoned his blood. Let's just come back a moment. This is a picture on page 63, tuberculosis of the spine. Shown here can deform the backbone enough to prevent sitting or standing. The spine is from a 12-year-old colonial boy who died of tuberculosis. Owsley believes that Levy neck boy's remains show the early stage of spinal tuberculosis. Let's look at the picture on page 64 before I read the text. And page 65. Studies of the boy's skull reveal more information about his luckless life. Most of his teeth had cavities. Owsley's careful study told more about Levy neck boy's life. In addition to bad teeth and tuberculosis, he had suffered from fractures in his hand and in the part of his arm bone called the radius. The huge pits in Levy neck boy's teeth, top and middle, must have caused him considerable pain and affected his ability to eat. Pus-filled infections attacked other teeth in his jaw. Bottom. Given the presence of these infections and the possibility of tuberculosis, it seemed likely that the boy would have been in a weakened state. He probably found accomplishing a full day's work something that an indentured servant would have been expected to do difficult, if not impossible, and that Owsley theorized may have been a factor that led to the boy's death. As the laboratory examinations of the skeleton continued, Owsley and Carrie Brewell noticed 2 fractured bones in the right arm. One fracture was in one of several hand bones called the metacarpals. The break was in the area of the bone closest to the boy's wrist. The other fracture was in the radius, the thicker of a person's 2 lower arm bones. The fracture in the radius was at the closest to the wrist, and it directly lined up with the fracture in the metacarpal bone. Because of this alignment of the 2 fractures, Olsey knew that they had occurred at the same time. Neither fracture showed any signs of healing, an indication that they occurred near or at the time of death. This type of fracture is consistent with breaks that occur as a result of a blow with a blunt object, a thick stick, for example. Some might someone have been angry that the boy wasn't doing a full day's work and hit him to make him work harder? Owsley suspected that the boy was mistreated in this way. Somehow, someone got carried away and an altercation got out of hand. He speculates that the boy died as a result. Another look at the circumstances of the boy's burial supports this theory. Owsley re examined the shards of the large milk pan under a low level of magnification. He found that the broken edges of the smaller pieces of the milk pan were sharp and jagged, the way a piece of broken ceramic normally appears. The edges of the large shard, the one that was believed to have been used to cram the boy's body into the grave, were rounded, as if they'd been polished smoother. I'm absolutely certain this large shard was used as a digging tool, Owsley stated. Someone grabbed the shard with both hands and used the broken edge to dig the pit to hide the body. He or she dug through the trash and then into the floor and part of the cellar wall. The formerly sharp edges of the shard became rounded with the scraping. There's no other reason for this kind of shaping. The act of grabbing whatever means were at hand to dig the grave rather than to take the time to get and use a proper tool indicates that the person or people who buried the boy's body did so in haste and secrecy. The clandestine circumstances of the burial further support this scenario. Had the boy died merely as the result of a farm accident, there would have been no reason to hide his death or his burial, other than to avoid burial costs. Together, the forensic clues have led Olsey to believe that the boy died of suspicious causes. The Levy next boy's carbon 13 isotope value was negative 19 and 39 hundredths, indicating that he hadn't lived long in America. He hadn't lived in America for a long time before he died. Many of his health problems may have originated in England. If so, his life there must have been difficult as well. On his long journey to the colonies, had the boy dreamed of opportunity, maybe of someday owning his own land? Life as an indentured servant would have filled his day with endless work and demanding chores, leaving little time for dreams. The boy's early death ended them completely.